you're at home and then there's an emergency and you have to go to the hospital. Like it sounded scary to me. So what are the risks of delivering with a midwife, delivering at home or in a birthing center? And how do you mitigate those risks? What do you tell that mom that's maybe scared to take that leap?
Sure. And it is scary, the thought of a hospital transport. So it's one thing that's encouraging to my clients if we do need to take a hospital transport is that I go with them.
Mm.
So we load up. If we go in an ambulance, I try to be a ride on the ambulance. If we go in a private car, I come along and then I stay for the
Mhm.
hospital trip. So, but yes, there is a risk with anywhere that you birth. There's a risk in
Sure.
the hospital. There's a risk in the birth center. There's a risk at home. There's a risk in the woods by the creek. There's a risk literally anywhere that you're trying to give birth. It doesn't mean that it's a dangerous thing by any means. But yeah, there is always inherent risk in anything that we do in life. So one way that I try to mitigate these risks is with very careful screening. So I try to work with families the whole way through, and we are discussing, this is your risk category right now. If we are getting out of this risk category for A, B, C, D, I would like to talk to you about it. If I tell people all the time, look, I'm not going to be being risky with you. If there's a reason that we need to go somewhere, then I'm going to be the first one to tell you. And like, we're working to build this bond the whole time. That way, if I'm saying these words to you, hey,
Yeah.
like we need to go in, that that I mean it, that that I'm not coming into it lightly. And most everyone knows how I feel about hospital settings by the
Yep.
time we get to the finish line of delivery,
Yeah.
and that I wouldn't be throwing those words around lightly.
Yep.
So we also limit risks with being able to carry emergency medications like antihemorrhagics.
Oh,
We
that's awesome.
Yes, yep. So in the case of postpartum hemorrhage, we are able to give life-saving antihemorrhagic medicines. We
Mhm.
are able to put in IVs for hydration. So we're not completely within our scope of practice. So in that in itself just minimizes risks as well. And education hugely, I feel like, minimizes risks because people actually truly know what they're deciding on, and
Mhm.
then they can work through it mentally, they can work through it physically, and have their ideas for what they want to do as well for their risk factors. And then that
Gotcha.
comfort itself, a lot of times it's kind of like packing a bag that you don't need.